I came to Jamkhed. My first trip was in 1992. I was an international student in the Community Healthcare and Development course. In order to start a preschool here, I went across the street and did a survey in the local kind of slum. And I noticed that a lot of the children, their family were very poor. They had very little food to eat. Nobody was living in a brick house. They basically were living in huts. And I was extremely worried about the safety of the children. So even though I'm a teacher, our main concern when we wanted to start the preschool program was not education, but nutrition and safety.
त्यांची जी गरज होती अन्न, त्या मुलांना अन्नच मिळत नव्हतं. त्या मुलांना 2 टायमाचं अन्न दिलं. अन्न दिल्यामुळं ते मुलांची बौद्धिक आणि शारीरिक क्षमता वाढली आणि मुलं शाळेत येण्याचं प्रमाणही वाढलं.
Our school is based on the principle of joyful learning, where it's not teacher-directed. We split up our children in small groups, so everything is based on activities and finding things out for yourself. We have a very warm atmosphere. We realize that some children may not feel wanted or welcomed in the family, but in our school we have a very warm and welcoming atmosphere. One of the things that we are trying is to build the children's self-confidence so that later on in life they will do much better. So we are also taking care of their future.
The school has given the children so much in terms of health, education, and a caring environment. The children love to come to school and enjoy the creative activities we have. They feel safe and loved, and they are so happy and relaxed.
Because it is child-centered and activity-based, the children really like to come to school. They are willingly coming. We never have to drag them to school, and the atmosphere is just, it's amazing. It's a joy to be there and spend time with the children. Renuka is a 4-year-old girl. She is a special needs child. She hears, but so far she is not able to speak, but she does utter a few sounds. We found out from the family that the mother died and there are 4 siblings. From one day to another, the auntie just got 4 extra children. She has 4 children of her own, and when her sister died, they just added 4 children. So now she has to raise 8 children, and it's a very poor family. So I can imagine that if you have a problem raising your own 4 children, to then raise 4 more children of your sisters, you have a problem to take care of all of them. So we are very happy that the auntie and the uncle have finally agreed to allow Renuka to come to school, where she is now amongst the other children. She is now making eye contact, she's smiling, and she has started to make some sounds, which is new. So we are very happy that now, with the help of CRHP, we can actually focus on this child and help her. We will always have to keep an eye on her in the future, but now that she is with us, we feel we can make a big difference in her life, and we are going to be there to protect and guide her in the future.
Many of our students now attend primary school after living here. Their parents now see the value of education, so we help change attitudes.
गेल्या 20 वर्षापूर्वी म्हणजे हा बालवाडीचा वर्ग सुरू होण्यापूर्वी या शाळेत मुलं शाळेत येण्याचं प्रमाण अत्यल्प होतं. शाळेत जी गळतीचं प्रमाण होतं ते गळतीचं प्रमाणसुद्धा कमी अत्यल्प झालं.
Our biggest achievement with our preschool and CRHP has probably been that for the first time in their lives, children from the slums have started to like school, and so even after they leave the preschool here, they go on to the government school, so we have been able to influence their future. And for the first time in their lives, these poor kids from the slums had such a good head start that they were becoming first in the class.